Ooh, ah.
Hello everybody, it's Ryan Liberty, and welcome back to this series on trauma and PTSD, everything that you need to know. In this section, we're going to talk about the different treatments that are available for trauma and PTSD. And PTSD and trauma have been heavily researched, so there has been a large number of treatments developed for them. A lot of these treatments have techniques that you can pull out and use for self-help if you're interested in doing that. And though these treatments vary in their approach, they all seem to focus on central areas such as changing your negative beliefs and behaviors, experiencing your physical sensations in the present moment, having an increase of your stress tolerance, and reconceptualizing and reintegrating traumatic memories. The different treatments that we'll be talking about include cognitive behavioral therapy, dialectical behavior therapy, prolonged exposure therapy, cognitive processing therapy, stress inoculation training, EMDR, somatic experiencing, and medications. Cognitive behavioral therapy. Cognitive behavioral therapy is the foundation for many of the therapies that we'll be talking about in this section. Cognitive behavioral therapy deals with your attitudes, your beliefs, and your thoughts and how they interact with the way that you behave. It's a structured kind of therapy, and very often there is homework that you'll do in between sessions, which you'll then discuss with your therapist when you come back. Dialectical behavior therapy. Dialectical behavior therapy is a form of cognitive behavioral therapy. It is done in weekly sessions, both individual and in a group, and that goes for approximately 4 months. Dialectical behavior therapy explores how we interact socially, and it recognizes that some individuals have a stronger emotional response to situations than others and aims to bring us back to a lower level of arousal by teaching us skills. Homework may include worksheets and practicing the skills that were learned in therapy. Prolonged exposure therapy. Prolonged exposure therapy is a form of cognitive behavioral therapy. It's done in individual sessions, and that lasts for about 3 months. In prolonged exposure therapy, you will list out the different things that you've been avoiding since the traumatic event has happened, and the therapist will work with you to gradually expose you to those things that you've been avoiding. Homework may include listening to recordings of the session that you just had, and then going out and practicing exposing yourself to those situations that you've been avoiding. Cognitive processing therapy. Cognitive processing therapy is a form of cognitive behavioral therapy. It's done in individual weekly sessions and goes on for approximately 3 months. In cognitive processing therapy, the therapist will have you list out the negative thoughts that you've been feeling about the traumatic event that has occurred, and they will help you to find new ways to think about it. Homework may include worksheets and practicing the skills that have been learned in therapy. Stress inoculation training. Stress inoculation training is a form of cognitive behavioral therapy. It's done in weekly sessions, and that will go on for approximately 3 months. It's typically done in group sessions, but can also be done in individual sessions. With stress inoculation training, you will get in touch with your stress level and learn coping skills to manage your stress level. Homework will include practicing the skills that you learned in therapy. Eye movement desensitization and reprocessing. Eye movement desensitization and reprocessing, or EMDR, is done in weekly individual sessions and goes from 1 to 3 months. During EMDR, you will learn coping skills to deal with your traumatic memories, and you will target specific traumatic memories in each session. During each session, while you review the traumatic memories, you will focus on a back and forth movement of something like a finger or a light, or you'll focus on back and forth sensations in something like hand paddles. In this therapy, there is no homework. Somatic experiencing. In somatic experiencing, the sessions are individual and they go for 1 to 3 months. During somatic experiencing, the therapist will monitor your physical reactions to your experience of traumatic memories and reorient you and your body sensations into the present moment. There is no homework for this mode of therapy. Medication. You'll want to talk with a psychiatrist to decide if medication is right for you. Antidepressants may help with any depressive symptoms you've been experiencing as a result of trauma or PTSD. Medications include Zoloft, Paxil, Prozac, and Effexor. Treatments for trauma and PTSD. Trauma and PTSD have been heavily researched, and as a result, a large number of treatments have been developed for them. Each of these treatments has things that you can pull out and use for self-help if that's an area that you're looking to explore. Although these treatment approaches all vary, they all seem to focus on some key areas, including changing your negative beliefs and behaviors, connecting with and experiencing your body sensations in the present moment, increasing your tolerance for stress, and reconceptualizing and reintegrating your traumatic memories. The different treatments that we've talked about in this section include cognitive behavioral therapy, dialectical behavior therapy, prolonged exposure therapy, cognitive processing therapy, stress inoculation training, eye movement desensitization and reprocessing, somatic experiencing, and medications. If you have an experience with any of these therapies that you'd like to share or any of these treatments, please leave them for the community because everybody's experience with trauma is a little bit different and everybody experiences these treatments a little bit differently. If you're enjoying this entire series on everything that you need to know about trauma, please go ahead and subscribe.